From burning bras to the Me Too movement, women have been fighting for equality for decades. And today, over 3 million women suffer from a common condition where the muscles separate in the belly during pregnancy. But amazingly, it's not covered by insurance. Medical professionals compare it to a hernia, but warn while most insurance companies cover the correctional surgery for men, many do not pick up the bill for the comparable procedure in women.
Yeah, now in tonight's Problem Solvers, Casey Montoya finds a battle of the sexes brewing in healthcare and a local surgeon armed to raise awareness.
In a lot of ways, I avoid wearing fitted clothes, and I'm still wearing maternity pants.
They say the joy of motherhood helps to forget the pain of pregnancy, labor, and delivery. And for 36-year-old MANASI Patel, that old adage is true, but the mother of two says today she looks like she's expecting number 3, even though her kids are 7 and 4.
I worked out for a whole year, and like you see, I lost all the fat on my arms and legs and everything except for the belly.
Many moms don't talk about the common complication Patel was diagnosed with called Diastasis recti, a postpartum abdominal condition where the belly sticks out because the space between the left and right ab muscles widen during pregnancy and never go back, leaving a gap that causes the belly to pooch out. Dr. Rahban is a plastic surgeon in Beverly Hills and says most women don't get it fixed because they don't even know they have it.
Often what happens is women will have children, 1, 2, 3, 4, etc., and we'll notice with each child their abdomen starts to look slightly worse. Many women just assume that they're just overweight.
Patel says she avoided going to formal events or even taking family pictures for years because of her pooch. Though more than cosmetic concerns, doctors warn diastasis recti can be extremely painful, plus affect mobility. The problem? Women who opt for surgery are being forced to pay out of pocket because the procedure is not covered by insurance.
The reality is insurance doesn't cover it because insurance doesn't want to cover anything they don't have to, and it's never really been a huge issue.
Dr. Rahban says it's far from a vanity issue. It can hamper a woman's day-to-day activities. Core strength is affected, and it can contribute to chronic back pain, constipation, and other issues.
I have so much of back pain now because all my lower back muscles are working. They're doing all the job for my core. I cannot sleep straight. I always have to sleep on my sides.
It's estimated at least 30% of mothers suffer in silence and show the complication is most common in women over 35, those who deliver a high birth weight baby, or have multiple pregnancies. Patel doesn't understand why insurance companies will cover surgery costs for a man with a hernia, but won't pay for this.
This is not something that I did to myself, right? It's pregnancy, it's supernatural.
I think if you were to compare a small hernia to a massive diastasis rectus patient, you can't even compare the two. One is almost disabled while the other one is, doing just fine.
Patel had to rely on her doctor, surgery, and savings to solve the problem, but says her mom bod is worth it and hopes to educate others who may be suffering and inspire insurance companies for equality.
When we're pregnant, we have all these classes. They teach you about how to bathe your baby and breastfeed your baby, but nobody tells you about your own body. There are no classes that tell you what happens to you.
In some cases, physical therapy can help a little, but like you heard, most insurance companies consider this a cosmetic procedure and generally won't cover surgeries not considered medically necessary. If you have a story for our Problem Solvers team, send us an email at KTLA problemsolvers@ktla.com. I'm Casey Montoya.